Ward?
Yes, sir.
Councilmember.
You okay?
I just want to spend some time with you.
You got it. Yeah, here we are.
Okay. Let me get the superintendent. Where's the superintendent? Oh, there you. Okay, you're I was missing you. Okay, Dr. First, you want to come in? We'll trade out as we go. Hey, council member. Thank you very much. All right, let's get started. Let me acknowledge Council Member Tiffany Thomas, who is president of District F. Council Member Carlos Cisneros of District H, who are here today. And then there are certainly a number of people who are here today. I certainly want to acknowledge our members of the congressional delegation, Congresswoman Sheila Jackson Lee and Congressman Al Green, who are also present with us. And then let me just say good afternoon and thank you all for joining us today. And thank you for wearing a mask as we move through this entire process. Dr. David Peirce, the Chief Medical Officer for the City of Houston, is here. Will be speaking. Superintendent Millard House of the Houston Independent School District. And then Dr. Janine White, the Local Health Authority for Harris County Public Health, will be here and will be speaking. And Shalia D. Reed, who is the Chief of Staff of Aldine Independent School District. I also want to acknowledge and recognize the following individuals who are joining us today. Kenneth Colbert, who is the Chief of Police for the Spring Independent School District. Dr. Michelle Epps of Galena Park Independent School District. And Dr. Keisha King Sr., the National Education Administrator for T-Mobile. Also, you'll be hearing from today will also be my Director of Education as well. As of July 26, 2021, anywhere between, let's say, 50 to 60% of people are fully vaccinated, depending on their age brackets, have been fully vaccinated. Unfortunately, this number is still too low to reach herd immunity, especially as we see a spike in the number of cases due to the Delta variant and an increase in hospitalizations. And again, as I indicated at City Council today, 3 weeks ago, Dr. Peirce, when I looked at the numbers in our area hospitals from COVID, it was a little bit more than 500 3 weeks ago. This morning, when I looked at that number, it said 1,614. Most of those individuals who are in our local area hospitals are individuals who have elected not to get the vaccine. Full vaccination is the best defense against COVID-19 and its variants, like the Delta variant. And as families and educators prepare to go back to school, it is critical that they get vaccinated. Now, I can't underscore that enough. I am a strong proponent of in-person learning. In order for that to take place, we need to make sure that the environment is as safe as possible. Families and educators have a right to feel safe going to a place they know and trust, such as school buildings, to get the vaccine. Since the start of the pandemic, attendance and enrollment decreased and absenteeism more than doubled at the height of the pandemic compared to the year before. Having more families and educators vaccinated will mean less students and educators getting sick and missing school. And that is why today we are announcing a collaboration between the City of Houston, the Houston Health Department, Harris County Public Health, and 10 Houston area school districts to get families and children ages 12 and above vaccinated. We're calling this Super Saturday Vaccination Day. Starting this Saturday, August 7th, the city, the Houston Health Department, And each of the participating school districts, along with the Harris County Health Department, will host a Super Saturday Vaccination Day in different school buildings throughout the Houston and Harris County area. Super Saturday Vaccination Day will take place every Saturday in August. The 10 independent school districts that are currently participating are Aldine, Alief, Crosby, Cypress Fairbanks, Galena Park, Houston, Huffman, Katy, ISD, Pasadena, and Spring. They all have at least one school participating, and more schools are being added as we speak. Children ages 12 and up are eligible for the COVID-19 vaccine. Anyone under age 18 must be accompanied by a parent or a guardian. Getting vaccinated is the right thing to do, but I also want to thank T-Mobile for donating up to 1,200 goodie bags to incentivize people to get their vaccines at any of the participating schools. Our goal and our hope is to administer enough vaccines to allow for parents, educators, and students to feel comfortable enough to return to face-to-face instruction and be better protected from variants of COVID-19. We must all continue to do our part to reach herd immunity. This week, I reinstated the mask mandate for roughly 21,000 City of Houston employees. The mask requirement is consistent with CDC guidance, provides a safe workplace for city employees, including first responders, and will minimize the spread of COVID-19 in the workplace and other adverse effects the city and its employees have experienced during this pandemic. Today, I am also asking the governor to allow local school districts to make decisions about whether students and staff should be required to wear masks as they go to school, to give that decision-making to the superintendent and the local school boards. I believe in-person learning is the best way to keep children on track, but with the increase in the positive cases and hospitalizations, our schools need to be a safe place for our children, staff, and educators, and we need to give them all the tools that they need in order to work in the best interest of our children. Now let me yield and let me first bring up Dr. Peirce.
Thank you, Mayor. And I can't underscore enough the Mayor's comment on the need for people to get vaccinated. Today in Houston, we're seeing a huge increase in the viral activity in the community to the point where if you are currently unvaccinated, you need to consider that you represent a potential danger to yourself and others, and most particularly your own family, because we have found that those who get infected are most often infected by another family member. If you look at the graph, you'll see that the positivity rate is coming up extremely rapidly. This is a huge increase over just several weeks. It's about a month from when it had that low point to the high point that you see now. As we go forward, we can only expect that that is going to go up more. And you can see that our cases over time, and this graph, like the one before, it compares the two big previous waves that we had, peaking last July and then peaking in January of this year. And you can see how steep this curve is rising, which you have to considers the momentum of the viral spread. And it is continuing to go up very, very sharply. We're seeing that our hospitalizations are also going up. And this is where, when my comment saying you represent a danger to yourself and others, is vitally important that you understand. The hospitals right now are full. The emergency departments are holding as many as 30 admissions in some hospitals, waiting for beds upstairs that simply don't exist right now. Hospitals are having ambulance crews stay with patients in the hallway for hours on end because they don't have enough room in the emergency department, because they don't have enough room in the hospital. So consider that many of these patients are COVID patients, but many of these patients are also heart attack patients. They're inflammatory bowel disease patients, they're stroke patients, they're car accident patients, they're moms in labor. There are other things that occur that are also getting backed up. And so while you may be thinking of this COVID situation and say, I don't need to get vaccinated, I don't think I'm going to get it. Well, if you're not vaccinated, you may get it. In fact, the way this is spreading, it's almost certain that you're going to get it. This virus is so extremely contagious, your chances of getting through this without having become either vaccinated or infected is essentially zero. So if you're unvaccinated now, you represent a risk to yourself of getting sick, to your family members that they may get sick, but also just because you're helping spread the virus in the community, heart attack patients, stroke patients, car accident patients are being brought to hospitals that just simply do not have the space to handle them, to the point where they're sitting on ambulance crews to staff the emergency department. And that's why you represent a risk not only to yourself, but really to the entire community. And we have got to break this chain. And the way to do it is by getting vaccinated. It's simple. Over 2.5 billion people on the planet have been vaccinated. If there was a problem with the vaccine, we would know it by now. So for those folks who say, well, I'm not so sure, I'm a little afraid, I don't know what you're afraid of. We are detecting problems, the rare problems, to the point if a problem occurs, 1 in a million times we know about it. That's the level of scrutiny that this vaccine has gone under. Far more scrutiny than any vaccine in history. It is a safe vaccine, it is an effective vaccine, and we need people to get vaccinated because our momentum is going in the wrong direction. And finally, this chart is a little complicated. When we first started testing the wastewater, with the first wave, when we had wastewater testing, was back in July of last year, over a year ago. And when we peaked at that, we set that value, the way you measure it, it's very complicated, but we set that value arbitrarily as 100%. After that peak last July, as we came down from that peak, from that wave, the amount of virus in the wastewater, of course, went down. And of course, the wastewater predicts what's about to happen about 2 to 4 weeks ahead of time. So we saw the value in the wastewater dropping before we saw the positivity rate drop and before we saw the hospitalizations drop. So it's extremely reliable. So if you consider that last July 6th was 100%, in June of this year, with that peak, it got to 250%. 2 weeks ago, we were at 231%, and last week we were at 370%. So the virus in our community is spreading rapidly, it's spreading everywhere, it is spreading very intensely, and we are at a level of virus in the wastewater that we have never seen before. And the wastewater predicts what we'll see in positivity by about 2 weeks, which predicts what we'll see in hospitalizations by about 2 weeks. So our situation in the hospitals, which is already dire and dangerous, I can pretty much guarantee you is only going to worsen over the next 4 weeks. So please, get vaccinated.
Thanks, Dr. Purse. Get vaccinated and put those masks on and be more scared of the virus than the vaccine. Now let me bring on Dr. Janine White, the local health authority for the Harris County Public Health Department.
And thank you, Mayor. As of yesterday in Harris County, including the city of Houston, we have greater than 17,000 active COVID cases in our community. Unfortunately, we continue to see an increase in transmission in our community, and we have a vaccine available. We know that the vaccines are safe and they work, just what Dr. Purse just mentioned. By getting vaccinated, we can reduce the transmission and work together to stop the virus from becoming more dangerous. We are excited to partner with the city of Houston. We'll be giving free COVID-19 vaccine to individuals 12 and older. We want to see our young people come out. We want their parents to come out. And we want our community to get vaccinated. Remember, we are a very resilient and strong community. We have been through so many events, and we've always pushed through and come out from them better. So again, we are excited, and we look forward to seeing you at our Saturday events. Thank you.
Thank you, Dr. White. Now let me bring forward Superintendent Millard House, who's come to the city of Houston and has been off and running at Houston Independent School District. Appreciate the collaboration that we're having with HISD. Dr. House.
As Mayor Turner indicated, I'm Millard House, the superintendent with the Houston Independent School District, and I want to thank the village behind us. It's extremely important that we have this group of individuals that are leaders that lead the way in terms of what vaccines are, how effective they are, and what we must do in terms of leading the way for our community. As you all know, our schools are the heart of our community and have served as COVID testing sites and now as vaccine sites. HISD has been on the front lines in providing back-to-school immunizations, and our health and medical staff is ready to support the COVID-19 vaccines and the Super Saturday that's coming up, organized by our mayor. 14 HISD campuses will take part in the mayor's Super Saturday Vaccine Day this month, and we're very excited about that to make sure that individuals in our community understand that this is a safe vaccine and it's important to move forward now and get it done if you haven't gotten it done. If your child is 12 or older, stop and get them the shot. No appointments are necessary. Increasing vaccination rates among our communities will help ease the worries of our families and their children returning to school. For some of them, it will be the first time inside of a school in 18 months. The back-to-school butterflies that many of our folks are having, and the stress of whether their child should be in a safe and healthy returning classroom can be eased if we pay close attention to what it is to get vaccinated. Rest assured, HISD is planning for a safe return. We are doing everything that we can to protect our students and our staff, but we need the community's help. I'm vaccinated. My wife is vaccinated. My 16-year-old daughter is vaccinated, and my 10-year-old son will be vaccinated once a release of a vaccine for 11-year-old and under happens. It's important to get it done if you are eligible and your health allows. This is a personal fight for me. I've had 2 family members and a very close friend that we've lost to COVID. So it's real to me. It should be real to all of us. It has robbed families of their futures, their memories, their first dances, their first driving lessons, their 60th birthday parties, camping trips, attending graduations. And it's so important that we develop the kind of normalcy that we need to ensure that these memories are not robbing anyone else. We will have the power to make those future memories be the memories that are positive for the future. Take your best shot and get vaccinated. Thank you, Mayor, for your leadership.
Thank you, Superintendent. Now let me bring forth Shalia D. Reed, the Chief of Staff for Aldine Independent School District.
Thank you, Mayor Turner. Aldine ISD looks forward to welcoming back our 67,000 students and 10,000 staff members in just under 2 weeks on Monday, August 16th. We want them to be in person for learning this school year. We know that school is the safest place, not only for our students, but our staff as well. We learned a lot last year. It was hard, but I believe we did a good job keeping schools safe. And while the decision for requiring masks is out of our hands, our top priorities remain: safety and academic success of all students. Masks will continue to be optional, but they are welcomed at Aldine ISD campuses and administrative buildings. We believe that if everyone does their part, including becoming vaccinated, we can keep our students, staff, families, and communities healthy. We will continue prioritizing making sure that everyone in Aldine ISD has access to information, resources, and even COVID vaccinations. On Saturday, August 7th, from 9 to 11, we will host our 6th annual Back to School Drive. It is an opportunity for families in Aldine ISD to not only receive backpacks, school supplies, but they can also receive a COVID vaccination. Not just the students of Aldine, but their families as well. So we encourage you to stop by again on Saturday on August 7th from 9 to 11 at our Back to School Drive at M.O. Campbell to not just get your school supplies for the first day of school, but to get that extra supply of a vaccination. You can find out more information on our website, aldineisd.org.
Thank you so very, very much. And now let me bring on Olivera Jankowska, who is the Director of the Mayor's Office of Education. Olivera.
Thank you, Mayor. My name is Olivera Jankowska, and I'm the Director of the Mayor's Office of Education. I want to start by echoing Mayor Turner's statements. We all need to do our part. Todos necesitamos hacer nuestra parte para proteger nuestra comunidad. Es muy importante para que los niños estén protegidos y puedan volver a la escuela. Getting the Houston community vaccinated is of a paramount concern for city leadership. This is especially true for our most vulnerable population, our students. Fully vaccinated rates for youth ages 12 to 15 is only 29%, and ages 16 to 17, only 40%, and that's the lowest of this particular age. The low vaccination rate amongst this demographic means the students within the Houston area schools are not protected from contracting and developing COVID-19 symptoms. And this is especially true for the COVID-19 variants. Our office fully supports City of Houston, Houston Health Department, and the local ISDs for urging educators, students, parents, and community members in getting the COVID-19 vaccine. From the outset, we offered our full support for the Super Saturday vaccination day. Like Dr. House said, this is also a personal matter. I was a parent who was working full-time and managing a child at home in virtual environment. How many of you have had that experience? I'm pretty sure a lot of us in this room. So we need to make sure that our children are vaccinated, are able to go back to school. I'd like to thank everyone who came to our coordination meeting, all of the 17 ISDs who came and talk to us about what their needs are and how we can do the Super Saturday event. Students returning to a safe, clean, healthy learning environment is of utmost importance. Vaccinations are part of the process of returning face-to-face instruction and some sense of normalcy. So I urge you to visit one of the many sites around Harris County or check the Houston Emergency website for particular locations that are serving the COVID-19 Super Saturday vaccination. And finally, I'd like to acknowledge that T-Mobile has been a very generous supporter, and they have stood with the government, education leaders across Houston, Harris County, the state of Texas, throughout the pandemic in order to ensure that students stay equipped with connectivity they need. T-Mobile continues to be our trusted partner in support of student success and digital equity by providing bags with school supplies for children to head back to school. So they're here today in the audience. If you could just raise your hand. We just want to say thank you for helping us to give away some of these items to our students to make things fun in the spirit of innovation. So like Mayor Turner said, let's all do our part. Muchas gracias. Yo también hablo español y otros 8 idiomas. Si tienen algunas preguntas, por favor, avísame. Estoy aquí, puedo responder lo que quieren. Gracias.
Thank you, Olivera. I was going to do that in Spanish, but you saved me from having to do that, so I appreciate that. Let me just say Saturday is Super Saturday, okay? If you're like me, in-person learning, and what I saw from the COVID effect last year, 2020, many of our kids got behind, and they're still needing to catch up, okay? And we need them in school. And so in order for them to be in school and everybody to feel safe that they're in school, we really need people to get vaccinated, get the shots in the arms. So let me just encourage you to take advantage of Super Saturday. I want to thank the Health Equity Response Team and for joining in, and complete communities and special events, and my faith-based leaders and all of that. I want to thank them. Now, all of this is possible because of resources that we receive from the federal level. So I do want to acknowledge our federal partners. They have helped to make all of this available. The resources that we're working with at the city level, the county level, our school district on the state level. So I'll be remiss if, and I know they probably didn't want to say anything, but I would be remiss if I didn't acknowledge them first. And so let me bring on Congressman Green, followed by Congresswoman Sheila Jackson-Lee.
Thank you very much, Mayor, for your Super Saturday Vaccination Day. It is one of these great ideas, one of the many that you have presented to us. I want to make 2 points. The first has to do with Dr. Peirce and the indication that we are likely probably more than likely to come into contact with COVID-19, more than likely. So the question becomes, do we come into contact with it after having been vaccinated or not having been vaccinated? That's really the question we have to ask ourselves. For me, Mayor, I thank you for being a good steward of the public dollars, the public trust, because I got my vaccination, if you'll recall, through the city because you were a good steward of public dollars, and I'm grateful. I've been vaccinated. If I come into contact with it, I think I've got a better chance of surviving it and dealing with it because I'm vaccinated. That's the first point. The second point is this. The mayor is eminently correct. We have appropriated $47.8 billion for contact tracing, for vaccination, contact tracing, and mitigation. $47.8 billion. This mayor has used these dollars efficaciously. He has demonstrated that this city, under his stewardship, is a place where you can be safe if you choose to be safe. You but only have to get vaccinated. Thank you, Mayor. Thank you.
There was little clapping in this room, and I think that the idea of Super Saturday with 17 school districts to come every week of August deserves a rousing applause. Mayor, I chair the Congressional Children's Caucus in the United States Congress and have worked over my tenure on children. And so my applause to you is a wake-up call to our parents. First, to thank you for having a city that cares about children. I think when parents realize that this is all about their children, this will be and have a different attitude. It is that this is Super Saturday for your children. Your children are carriers of COVID-19. It has been determined, Dr. Peirce, I think my facts are right, that many children are asymptomatic, and therefore they can carry COVID-19, and the Delta variant, which is deadly, follows what I understand the same pattern, that they can have it and spread it. The other data that is very clear is that children are being hospitalized. Children are not just carrying it, they're getting sick. And you can ask the hospitals of our community and they will tell you that children are being hospitalized. And so I frankly believe what we're doing today is life-saving. I frankly believe August 7th is the beginning of a life-saving journey that we will take. Now let me advise everyone of something that you already know. As a member on Homeland Security, as my colleague is, we are coming upon hurricane season. I believe it is imperative that you get prepared. Now, some of you may be getting the extra candles. Some of you may be getting the extra food. I think for your children's sake, you should get vaccinated. And if they are 12 and older, they should get vaccinated. No one knows what shelter you will have to be in. I would hope that we had no hurricanes. I'd love that. I know the mayor would, and the work that he has done over the years. But if we have an active hurricane season, do you not want your children, first of all, 12 and older, and those that come under that, we are hoping for a vaccine, to get vaccinated. Then, wouldn't you want yourself to get vaccinated? In speaking to this last point, the Lyndon Baines Johnson Hospital, they have over 100 patients of COVID-19 in the hospital and more coming. That's our public health system. And so this gift of a Super Saturday, partnering with Harris Health, Harris County Health, all of our school districts, let me applaud them for their leadership. Our council members, I call Councilman Cisneros, and I saw Councilmember Thomas, I believe, was here. They are education council members, and I'm grateful to them. But I don't want to say warning, Mayor, because that's your duty. I can't warn anybody here. But what I will say is that it is time to get ready, to be prepared at all fronts, And I'm grateful to live in a city that is a children's focused city. And that is what this is, a children's focused time and event. Show up and get vaccinated, you and your children, and get prepared. Thank you, Mayor, for your leadership.
Thank you, Congresswoman. Thank you, Sheila Jackson Lee and Congressman Al Green, and thank you for your advocacy and the financial support that you have provided to all of us, and very much appreciate that. Certainly want to acknowledge Judy Harris, representing the City of Houston Health Department. Director Williams is out, but Judy is here for any and all questions that may come. Again, as I can't say enough, bear in mind that the mayor's back to school event, annual event, is August the 14th. Where we'll be providing backpacks to 25,000 kids. In addition to those backpacks, we'll make vaccines available as well. So August is super month. This is Super Saturday. Again, let me thank Aldine, A-Leaf, Crosby, Cypress, Fairbanks, Galena Park, Houston, Huffman, Katy, Pasadena, and Spring for being a part of this collaboration, and others to come. Yeah, give it up. Okay, let me stop. Any questions to any one of these persons?
It's the questions for Superintendent House.
Superintendent.
Hi there, Superintendent. I was wondering, we saw the city earlier this week sort of buck the governor's order and require masks for their workers. Has the school district considered doing something similar? Why or why not?
We have not, but we do know that masks are important, and masks will be strongly encouraged for all of our schools. Not something that we've done in terms of, as you articulated it, bucking the governor. But we are strongly encouraging masks for all of our employees and all of our students.
I think the penalty for violating the order is $1,000. Why not, take that fine and then be able to require masks if you believe it's the correct public health guidance?
Just not something that we've moved forward to do. Our hope is that we'll see as many people move forward to be vaccinated, and many people move forward and do the responsible thing and wear masks as well. That's what our hope and expectation is.
I know there's a lot of concern among parents about obviously coming back to school with the Delta variant spreading and the lack of maybe measures that the governor has limited, but can you talk about what you guys expect for the start of the school year? Do you expect maybe some parents will hold their kids back, and do you have a contingency plan for remote learning if that does happen?
Of course, I can't speak to what individual families, 210,000 individual families will do. As a parent, I'm sending my children to school masked up, ready to learn. Of course, just in the past week, we have released our Ready, Set, Go plan that really speaks to everything from how we're screening students coming in, the hygiene, the sanitation and disinfecting, the mask, not a mandate, of course, but a strong suggestion. Also, visitations in terms of people coming into the school, athletics, extracurricular activities, student uniforms, as well as our meals, what we're doing on school buses. So all that has been comprised into our Ready, Set, Go plan. It has been released, should be on our website, available for all of our community and patrons to take a close look at.
Can you talk about the district's policy of notifying parents and staff when students or teachers test positive for COVID?
So, of course, we're taking a close look at all of our policies and structures in reference to notification of parents. There's nothing from our dashboard to notification of parents that we want to hide. We want to be transparent and let parents know when there has been an exposure. And speaking of exposure, one of the questions that I've gotten quite a bit of most recently is, what is the threshold for shutting the school down? And I want to make it clear that there's not a particular threshold. I think we have to look at every situation separately. It may be that because we've had spread in a particular classroom, but there hasn't been exposure outside of that classroom, that we shut that classroom down. It may be that we shut a grade level down. So we'll take a look at situations by situation to determine exactly what those cases will look like, and determining in reference to shutting classrooms down or schools down or classrooms down, et cetera.
So is there a policy yet for notification, or is that still in the works?
Not a policy in reference to notification, definitely something in the works.
Okay.
Yep.
And then one last question, sorry.
Sure.
Will students and teachers be required to quarantine for 2 weeks after testing positive?
So yes, that is something that is supposed, there'll actually be notification, I believe, that's coming from the state level on Thursday. That speaks to students not being able to stay in school once they've been identified as COVID positive. Same thing for employees as well. So to answer your question, yes.
Okay. And will they have a remote option, or will they just be absent for that
And
time?
that's a part of what's going to come out at the state level in terms of some funding. I haven't gotten the particulars of that, but I understand that it is coming.
Awesome. Thanks, Superintendent. Appreciate
My
it.
pleasure.
Yes, sir.
Pool question from KHOU to Dr. House. My question is, what do you think of local petitions, including by HISD parents, to get the governor to allow districts to mandate masks?
Say that. I was trying to find you. I'm sorry. I couldn't find you behind the camera.
What do you think of local petitions, including by HISD parents, to get the governor to allow districts to mandate masks?
I think parents should have the right to speak their piece. And whether that's community groups, whether that's the leaders behind us today, everybody should have a voice. And it's important for leaders like myself, whether it's state officials, city officials, to listen. So we will listen to those concerns, but we're going to do what's in our best interest and to the best of our ability to ensure that we have the safest return. We need our students back in school. We need our babies in front of highly qualified teachers. And we know what has to be done in order to do that, and that's to get as many people vaccinated as possible.
Next question is for you, Mayor.
You know, I was perfectly fine with the superintendent. He was doing an excellent job, and I was just here just supporting him. So stand ready, Superintendent. I may bring you back. Okay, what you got?
What is your response to President Biden's comments yesterday that Texas and Florida are making bad health policy decisions?
I really don't think you need a comment from me on that one. Let me put it this way. This coming Saturday is Super Saturday. I want to focus on something very positive, especially for our kids, for these teachers, bus drivers, cafeteria workers, all of the individuals that take care of our kids. And I want parents to bring their kids out to these different schools, these different school districts, so that we don't have to worry about people being sent home for 14 days or whatever that may be. You know, from March of last year up until December, we did not have vaccines. And so when that virus hit, schools came to a halt. We had remote virtual learning. But now we have these vaccines, and they do work. And so what I want to do is encourage parents and everyone else to take full advantage of these vaccines, take advantage of Super Saturday, this coming Saturday. These 10 school districts are working in collaboration. That's a good thing. Working with the county, that's a good thing. The congressional delegation and others have made these federal dollars available. So there are some positive things we can do. I do encourage parents and teachers and bus drivers, and cafeteria workers and business leaders to petition the governor to allow the local superintendents and the school districts the tools that they need, what they decide. If they want to mandate masks, that should be their decision and not a decision out of Austin or someplace else. So I do encourage you. The power vests in the people themselves. So I do encourage them to petition the governor to do that, because these numbers are rising. You heard what Dr. Peirce had to say. When ambulances are having to hold for hours with people inside these EMS units, that points to the severity of this situation, and it's only getting worse. So I do encourage that. So that would be that comment. You know, I'm kind of exhausted of getting into a tit for tat with the governor, okay? And it's not serving any useful purpose. So let me just focus on these kids that need our effective stewardship on their behalf. And let me encourage the media, I appreciate you all being here, to really help us to advertise Super Saturday, okay? Let me encourage all of the influencers out there, entertainers, and you name it, that are out there, to encourage people to take advantage of the vaccine on this Super Saturday. So let me stay there. I'm in a good place mentally, and I kind of just want to stay there. You almost got me going, but I just want to kind of stay where I am right now. And I'm so elated to be up here with, you know, the superintendent, the congressional people, the chief of police of Spring Independent School District, my council members, and all of these other individuals, T-Mobile that's helping out. I just kind of want to stay there and just make this a positive situation. So let's just keep it there.
Quick clarification, 10 school districts, Mayor, or 17? I
We're
count
working
10.
on 17.
You're working on 17.
10 have already committed. I got there? 11. 11 have already committed. We got 16 to come in and be a part of this effort. Okay? 17 school districts that traverse the city of Houston. Okay? Anything else?
One more pool question.
Sure.
And just for clarification, these are not my questions.
I understand.
Okay.
I got you.
What do you say to those who claim you're violating Governor Abbott's executive order by banning mandates by required city employees to wear face masks?
No hablas inglés, solamente español. Translated, I don't speak English, only Spanish, you know. Look, I think the steps that we're taking here at the city will be saving people's lives, okay? I have a responsibility to do everything I can within my power to protect the safety and security of people in the city of Houston. I choose not to abdicate that role, and I choose not to give it to somebody else. And the last time I checked, there's only one mayor at a time, okay? Only one. No person's power is absolute. And you will give, person will take as much as you are willing to give. But when I look at these numbers and see them escalating in our hospitals, and when I look at these kids that are needing these vaccines, and employees who are coming to work every day to service the needs of the people in this city, I'm going to do everything within my power in dealing with this pandemic to give them the tools that they need. I will not yield my role to somebody else who's not the mayor of the city of Houston. So at some point in time, the people in the city of Houston, the people in this state, others will have to say to people in certain positions, you have exceeded your authority, okay? And when I believe you've exceeded your authority, and it's a life or death decision, I'm going to make the decision that's in the best interest of the people in this city. And I'll continue to do that as long as I'm mayor, okay? And that's why I'm here. And especially for those who are least capable of fending for themselves, I will always stand with them. So that's my response on that. Now I got to get back to my happy place. I'm in a good place, and I want to stay right there. Okay, thank you all so very, very much.
Thank you, Mayor.
Thank you.
What do you want?